I'm Robin Staines, for those who don't know me. I am the president of Advance Illinois. I have had the pleasure of leading this organization for the better part of 15 years, which is how long that we've been in existence. And we've been doing a legislative forum every year, and we try to pick a topic that is timely and that is relevant, where legislators are going to have some decisions to make and some visions to bring to life. And this year it was really clear, we always have to decide it months in advance. It was clear that this was going to be a year where early childhood was and should rightfully be a key topic of conversation. And that was even before the governor made his inaugural remarks, even before the budget address where some exciting new things were put on the table. But one of the reasons we knew it was coming is the same reason that Representative Davis was going to welcome you tonight, which is that we have a plan. I think it's clear, we all know how critically important early childhood year and the birth to 5 years and those early years in school. We know it sets the table for how children are going to do later in life. We know that there is Nobel Prize winning economists who will tell you that the payoff that you get when you make those investments are worth every penny and then some. We also just know it because in this room we're parents ourselves, or we're aunts or we're uncles, and we see how vital and important the growth is in those years. But the reality is it's a complicated space. And if you aren't clear-minded, it's going to be hard to make change, no matter how important you think that change may be. So we are excited to have some time tonight. We're going to be hearing from some national experts about early childhood and what does it take to really transform early childhood to meet children and families' needs. We're going to be hearing from a provider about how early childhood plays out, what some of the opportunities and pain points are. And we're going to be joined also by Deputy Governor Martin Torres, who is going to be able to offer some windows into some of the bigger picture plans that the governor is very excited about. So it's going to be a really lively evening. But before we get into that, and keep eating, I don't mind. I mean, try to be quiet about it, no side conversations with your neighbors. I'm looking at you, Brian Durham. I want to set the table with a couple of facts, just so that we're all grounded on a few things. And this seems perfect for so see, Representative Davis, you're welcome. Glad you're all here. I actually really do. I'll say nice things about him when he gets here, after giving him a hard time for being late and not just ending his committee in favor of this. I think that was very poor decision making. I also want to thank, this is always a big co-sponsor production. We've got 40 other organizations that are co-hosting and co-sponsoring this with us, so you may have heard from them as well. It's so many, we put it on 2 different slides, but see how I'm filling time so you can really absorb this, because I want our partners to know that we really appreciate it. We split it into 2 sides so your logos would be bigger. Is it working? All right, so thank you very much. It matters, and one of the reasons we like to do that way is because there is nothing of importance in this state that gets done by ourselves. It happens in collaboration and it happens in partnership. And that's always been the way Illinois has worked. So even when there are tough issues and even when we don't all agree, that we come together, we talk things out, and we continue to work collaboratively. So here I'm going to set the table. First of all, we know we've got issues. We know that far too many children lack access to early care and education programs. So let me ground you in a few numbers, because we at Advance Illinois, we love our numbers. There are approximately 800,000 children under the age of 5 in Illinois today, about 40% of whom live in low-income households. At most, about half of those children aged birth to 5 from low-income families are receiving state-funded services. I want to say that again, about half of those children are receiving state-funded services birth to 5. Those numbers are a little better for our 3 and our 4-year-olds, but you need it all. You need that across it. According to statewide developmental data, less than 30% of young children are entering kindergarten fully prepared for success. And that's when you look at some of the cognitive academic growth you'd expect to see, but also the developmental, where you'd expect children to be developmentally. This map, the one on your left side, is a little bit outdated. It was 2019. It's been a little bit hard to update because data has been messy thanks to COVID. But what this reveals and makes clear is that we have gaps, that the amount and the availability of 3- and 4-year-old programs is not evenly distributed across the state. That's a function of several things, including that we've got an RFP process, so there are winners and losers. And you've got variations in the capacity of people who have the ability to get those proposals in. This represents the pre-pandemic data. According to data that was recently shared by ISB, half of all young children living in low-income households outside of Chicago live in a school district where there are not enough preschool for all or Head Start seats to serve at least 80% of those 3- and 4-year-old children. And that marker becomes important because that's something that a few people here in the room, a lot of people here in the room would like to change. So I mentioned the commission. One of the first things that Governor Pritzker did when he took office his first term was he established a commission on early childhood funding equity, which necessarily led into the issues that bear on how do we use funding, what do we need it for, how do we distribute it. And the commission met, started meeting before COVID, decided when COVID hit that not only would it not hit pause, but the reasons for the commission were all the more abundantly clear because of the crisis and how it was playing out in the state. And it came out with recommendations just under 2 years ago. I'm going to share with you the 3 main recommendations and some of the work that's gone on so that we have that in mind before we hear from our national experts. They're going to speak to that and before our panel weighs in. The first recommendation was to advance equity and quality. We needed a long-term funding goal. We needed to know what should we be spending in the birth to 5 years, because coming into the commission, we didn't. And we now have an agreed upon methodology for determining that factors in things like what should compensation really look like for early childhood if we were fairly compensating? What if we were serving the numbers of children that we should be serving? What if we were doing that for 3- and 4-year-olds, but also early intervention? And the number, we're about $9 billion or more off. That is not a small number. We're going to need a long-range plan, but we now know what we should be spending, and that is a powerful start. Number 2, to make sense of the system, we have to coordinate early childhood funding. The commission specifically recommended centralizing state appropriations and federal funding so that the blending and braiding that has to happen doesn't have to happen by every single provider who needs 5 PhDs to figure out how to do that. And is it 5 or is it now up to 6 PhDs that you actually have to have in order to know how to blend and braid? You can't do it as intelligently, you can't do it as strategically if we're making everybody figure out. And parents, by the way, get caught up in that because they've got to know where they're eligible and what they're not and what the blending and braiding and how it's going to affect them. It's no way to run a railroad. Commission made it clear that you needed a coordinated approach so policymakers and state leaders could send money where it was needed most and it would be more predictable and more stable. Recommendation 3, you know what would make it much easier for parents and providers and everybody to be more strategic, to be more coherent, to be more driven? Centralize early childhood programming into one state agency. And the recommendation was to create a new state agency, which has been happening increasingly around the country. It's not an easy thing to do, talking about bureaucracy, not always the sexiest thing in the table. Turns out it matters enormously. And threaded through all of these recommendations were 2 other very clear themes. 1, you've got to deal with your workforce. You can have all the plans you want, but if you do not have a workforce, it doesn't matter. And that means you got to deal with compensation, you got to deal with pipeline. And 2, you've got to have ways in a state as big as Illinois of really hearing from local parents, providers, and others. You need a regional and community-based system of listening. So these are the recommendations. It's been 2 years. We all know that in government terms, 2 years is nothing. But in that time, we've done a lot. And that's the other reason it was so obvious this was the topic we needed to have. On adequate funding, there have been increases in both state and federal early childhood funding over the last 2 years. In terms of dealing with how do we get more equitable funding mechanisms, COVID relief dollars first of all, there was a whole crisis. The state stepped in to make sure they had to do things differently. We can't use a reimbursement system when kids are falling off and coming back in. There would have been no system to fund. And so COVID relief dollars were used to pilot new, simpler ways of funding childcare providers upfront in a more predictable and stable way. And there was a real commitment on the part of the leadership at the state to figure out what lessons they could learn and how could they grow that. There's also was a new funding equity map analysis, which let us, for the first time on paper in a way that you could share with others, look at where money was going for various programs. How is our money actually spreading out? And it's not going to surprise anybody. It's not flowing in a way that is strategic or equitable the way as a state I know everybody in this room wants. But now we've got the tools and we are going to continue them. Huge. Governance. New regional birth to 5 Illinois infrastructure. That was a recommendation. The state and the governor's office moved on it immediately, and there are 39 of these local community and regional birth to 5 collaboratives that are now up and running. Federal dollars have been used to help get them started. We're going to have to figure out how to continue that. When you talk about bringing everything together into one place instead of having it spread across 3 different agencies, the Department of Health and Human Services, which is where a huge number of programs live, hadn't ever been brought together in one place, and they now are in the wake of the recommendations. All of those programs have been brought together into one division. So we've already taken a huge step toward a more consolidated, strategic, sensible, coordinated plan. In terms of supporting the workforce, there is an Early Childhood Access Consortium for Equity, ECEC, for those of you who heard it by that. If I didn't have it written, I would not remember what those things stood for, but I know what it's doing. And what it's doing is making sure that we have a pipeline strategy to bring people into early childhood and a strategy for upskilling people. So what are the scholarship opportunities that we need to have? How do we put them in place? And how do we make sure that we're bringing people into that pipeline? I don't know how many hundreds it's already serving, but it is in the hundreds and growing. And then ongoing efforts to bolster compensation, some very direct efforts to try to tie new dollars to increase compensation. That's how much we've already done. And I think everybody who would agree that's impressive for 2 years' time, right? Can we applaud that? That's a lot of progress. And now that you all feel very good about yourself, this is a prelude to what we need to do next, because as important and impressive as this is, there is a lot more to do. And so without further delay, I am going to ask, we're going to be joined by Linda and Dan. We're going to be joined by two experts, and we're going to do things, this is going to be kind of fun. Linda and Dan know each other well. They're a little bit of a roadshow. They're going to come up, they're going to have a conversation amongst themselves. I'm going to tell you a little bit about them. Then, when they reach the end, and if they don't reach the end on their own, I will, give them the hook. We're going to be joined by Martin Torres and Emnet Wuori, and we're going to have a group conversation that I will moderate. But first, let me tell you a little bit. Linda Smith is the Director of Early Childhood. Is that me?
Maybe
no, that's
me.
You. Dan,
Sorry.
dear Dan. Linda Smith is the Director of Early Childhood Policy at the Bipartisan Policy Center, which is a Washington, D.C.-based think tank that promotes bipartisanship and actively works to find common ground around early childhood. One of the things I'm sure she will touch upon is early childhood a bipartisan subject? I know you're going to have something to say about that. She is deeply knowledgeable. She worked with the military to develop a plan around how do you make sure you get good early childhood services to military families. In a way, I think there are a lot of lessons to learn from there. She's worked in almost every educational agency at the federal level you could shake a stick at that has to do with early childhood. In other words, she knows her stuff. So we're very excited to have her. Linda, welcome. Thank you. And Linda is joined by Dr. Dan Wuori. Dr. Dan is Senior Director. Did I just call you Dr. Dan? I did just call you Dr. Dan. That sounds like you're a talk show host.
You're not the first.
I should ask you for relationship advice.
And Dr. Phil.
Yeah, there we go. You're going to give him a run for his money. Is Senior Director of Early Learning at the Hunt Institute. And I'm sure many of you know that the Hunt Institute is a nonpartisan education policy resource to the nation's governors and lawmakers of the state that was founded by North Carolina Governor Jim Hunt, who sort of famously worked across the aisle. But in addition, it's important that you know that Dr. Dan, I'm just going to stick with that. I'm liking that. It's working for me.
It's got a good ring to it.
Is a former kindergarten teacher. He's a former school and district administrator, and he was the deputy director at South Carolina's First Steps, I'm getting the name right this time, First Steps to School Readiness, which was designed to look at state. So he's got a lot of state expertise and some federal knowledge. Linda, a lot of federal expertise, good state knowledge. I'm going to let you two have a conversation, and then we'll be back with our panelists, and away we will go. Thank you for being here.
Fantastic. Thank you so much, and thank all of you for being here. We are really grateful to Robin and to Advance Illinois for the invitation to be here. I am, as Robin mentioned, from South Carolina, so we think about Southern hospitality. I have learned definitely in the past 24 hours that there is also Illinois hospitality, and so I am very, very grateful for the Advance Illinois team and how this has worked. Robin mentioned that Linda and I have become a bit of a roadshow, and that is true. This is actually the fifth or sixth time, probably in the past 6 or 8 months, that Linda and I have been asked to come together and have a conversation like this. I think that happens for a reason. I think our organizations have carved out sort of a unique space in the early childhood policy world, and that space is really squarely in the middle. We both organizations, and I know Linda and I personally, really pride ourselves in working across party lines. We both do work with sort of the reddest of the red and the bluest of the blue on the political landscape, and we really pride ourselves in the fact that we are nonpartisan, non-advocates. Certainly we are advocates for good things for kids, but we do not come to this work with a specific agenda. We take a very consultative approach when we are working with policymakers. And so, it's a special place, I think, that we hold in the early childhood world, and that is that we really see ourselves as sort of honest brokers in this conversation. So, with that, we learned that it was very boring if Linda or I stood up and did a PowerPoint presentation, but much more engaging when the two of us just have a little bit of a conversation. So we'll do that for a few minutes, and then we've got some other panelists, as Robin mentioned, that are going to join us up on stage. But we'll just sort of kick things off. And I know, Linda, in this group, we know that there are folks maybe with strong early childhood backgrounds who have come because of the topic tonight, but maybe others who are not as well versed in early childhood, who maybe have been faithful attendees at Advance Illinois events, maybe for whom this may be some of the first conversation that they're having on early childhood. So maybe start us off and share just a little bit about why do the years of early childhood even matter, right, to children, to families, to taxpayers, and then maybe give us your assessment. And I'll forewarn, Linda and I are gonna elbow one another anytime we get too jargony. So if either of us says something that we could jump into acronyms or something, clink your glass or something, and we'll unpack that a little bit. But why is this important? And maybe what's your assessment of sort of the landscape right now in this particular moment in time?
Well, Dan, I think we both would agree that we learned an awful lot out of COVID. And I think it goes without saying that many in this room knew this before. I mean, I think we don't have to sit up here and tell you about the brain science and all the rest. I think the country understands the brain science. The question is, what do we do with that, and why does it matter? Well, it matters to literally every segment of our country. If you think about it, the impact that the lack of quality early childhood has on parents, on families, on our economy, on our businesses, on our healthcare system, and then to the point of the earlier conversation about what happens with our schools. So there's literally nothing that early childhood doesn't touch in some way and set children on a pathway that's either good and positive or very negative by the time they actually get to our schools. So what did we learn from COVID, I think, is one of the things that I have said to several people lately. I have one mission in life now, and that is for this country to understand why childcare is failing. And childcare is failing in the United States. First of all, we don't have a system, and I resist using that term. But we don't have a system of care. And what we have are somewhere close to 700,000 random businesses operating independently. The one thing they share probably is a regulation and a license. But it really stops there because we have a lot of businesses operating independently. And what that means is multiple things. They don't have an awful lot of support in different ways from different parts of the communities. But I think more importantly, the business model itself, and here's the point I hope I can help everyone leave this room with, is in the simplest of terms, as I've said this everywhere I go, childcare is a business in the United States. Whether most of it's for-profit, about 75% is for-profit, and about a quarter of it non-for-profit, but it's for-profit. And when you have a business that produces a product that simply costs more to produce a quality product than the people who need to buy it can afford to pay, you've got a broken business model. And it really is that simple about why childcare is failing us. And we have really got to start looking at the business model of childcare and how do we fix that. What we found out in COVID, and everyone here in Illinois found it out just like the rest of the country, in many states in this country, first of all, the Centers for Disease Control lumped childcare in with education and said, okay, they recommended close it down. Well, first thing, many governors did that. And then the next thing they knew, they had essential workers that had to go to work. And what are we going to do here? We don't have childcare. So that was a mistake, and we quickly backtracked from that. But what the country learned at that point was that childcare is a business, and it is not necessarily part of our school system where the buildings were there, the teachers got paid, the lights were on. But guess what? In childcare, no income from the parents, the teachers didn't get paid. People started to close their doors, lose their leases, etc. So in a nutshell, what we learned from COVID is just how important childcare is to every one of those pieces that I said earlier. Healthcare, health workers couldn't go, not just what happened with the healthcare itself, with the health of children, but what happened to the healthcare system because the parents needed care. So you look at every piece of this, and I think in a nutshell, that's why it matters to this country, and we need to deal with it. To put our heads back in the sand after what we learned from COVID would be a real mistake on the part of this country.
Absolutely, and I think one of the things that we know, and I know we've got a number of the staff from Council for a Strong America here in the room today, but the question of how do we pay for this is always coming up. And I want to call to your attention a very important report that was released just a couple of weeks ago by Ready Nation, which outlined the economic impact on all of us, on the American economy, based on an absence in particular of infant toddler care. So it didn't look all across the system, just at infant toddler care. We went through here just 18 months or so ago, a prolonged conversation about whether the federal government was going to step in and provide what at the time was viewed as sort of an avalanche of new money, right? They were proposing $100 billion over 3 years, and that price tag ultimately was its undoing, right? That it did not proceed at $100 billion over 3 years. What Council for a Strong America and Ready Nation have told us here in just the past few weeks, though, is that the annual impact of an absence of infant toddler care is $122 billion annually, right? So, 3-4 times the amount that the administration was proposing over a 3-year period. What we, and incidentally, 4.9 billion of that 122 billion is realized here in Illinois. So, part of the issue is really not how do we pay for it. We're already paying for it. We're paying for it, though, in all the wrong ways. We are paying for it in terms of foregone wages and lost jobs and inability to advance in jobs as parents are struggling with this issue. We are dealing with it in terms of lost productivity and profitability among employers, and taxpayers are paying for it. I know there was this question of, do I pay for someone else's child care? You're paying for somebody else's child care already, because the absence of it is preventing dollars from coming into state economies at this point. So, I think one thing, that I would want to share with you, though, is that we are seeing huge progress. I mentioned Build Back Better. It did not move forward, and it did not move forward on partisan lines. I don't know if you've noticed this. Congress doesn't always seem to be terribly bipartisan these days, but what we are experiencing, certainly through our work at the Hunt Institute, and I know Linda is seeing it at BPC as well, is that this is a hugely bipartisan issue in the states. The polling tells us that voters, whether they are Republican, Independent, or Democratic, are overwhelmingly in support. And when I say overwhelmingly in support, there was polling out of Pennsylvania just 2 or 3 weeks ago. 98% of voters said that they approved and supported the idea of Pennsylvania putting more state dollars into expanding child care and pre-K. Just today, an hour ago, I was looking at new data out of Nebraska. 84% of voters in Nebraska saying that they supported more state-level investment and that we might fund childcare in the same way that we do K-12 education and higher education. We're seeing this across the country. You all know that there were 36 states that held gubernatorial elections this year. Governor Pritzker certainly made early childhood a part of his platform, but you know who else did? Sarah Huckabee Sanders in Arkansas also campaigned on an expansion of pre-K in her state. And so we're seeing this in red states and blue states. Governor Kelly in Kansas declared that she wants to be the education governor, but she wants to be the child care governor in her second term. So I know that you all have heard that Governor Pritzker has announced that he wants Illinois to be the very best place to raise a child. I will tell you that you have competition on that front. There are other governors who are declaring very much the same thing. But boy, that's the kind of competition I think we want to see right around the country.
So I think one of the things that I think we all want to address, and we're bouncing around this issue here in the country, is one of the most critical pieces, I think, of the childcare system, obviously, is the workforce. And for anybody who doesn't know it, the research is crystal clear on the fact that the most important thing in a quality childcare program is the relationship between the worker and the child. And that's what produces quality outcomes for children. And so what are we going to do about this workforce? I mean, we were talking earlier, and you said you had 25% roughly unused capacity in their program because they can't hire teachers. We have teachers, and I think one of the interesting things, I want to throw out a couple of facts on this one that we didn't talk about earlier, but roughly 50% of the early childhood workforce in this country has an AA degree or higher. And I don't think most people know that about it. We've spent a lot of time and effort in the country over the last few decades trying to improve the quality of the workforce, and we've done that. So AAA, that's not bad for what we have. But that said, half of the workforce in this country also qualifies for public assistance programs. So that's the problem with the pay being so low. We've managed to increase the pay a few dollars an hour, but that's only up to $13 an hour when the state minimum wage in many states is now $15. So this workforce issue. But I don't want you to leave with this simple idea that it's just, okay, well, we'll just pay them more. Because as I was saying earlier, I'm like you wave a red flag in front of a bull when people say that to me. Because the problem is not just about the pay, but it's how are we going to get the money into the programs to pay teachers more what they deserve without raising the fees to parents? It goes back to the supply versus the demand side of a business model. And when parents can't pay anymore, how do we pay the teachers? And that's where we're stuck in this country. Now, what did we learn from COVID? Well, we learned we had to put money. We learned several things. And first we tried to just do more with the, paying higher rates for low-income kids. And that didn't save the And then we did a few other things. Well, let's base the rates on attendance, enrollment, not attendance. But that wasn't enough either. And why wasn't it? Because that is not enough of the system's income to make that big of a difference. So, to their credit, Congress came in with the stabilization grants. And how did we put that money into the system? We put it into the programs. And then the programs could pay the people. Now, you heard, say, my background with the military. One of the things that we learned in the DoD system, which is one of the bigger systems in the country ever taken to scale, was that in order to pay the teachers more, which we did, we gave the money to the programs, and we said to the programs, okay, if we're going to give you this money, we expect you to pay the teachers more, we expect you to train the teachers, and we expect you to pay benefits to those teachers, and not raise the fees to parents. We kept the parent fees down. You see where I'm going with this supply and demand thing. I think we have got to figure out how we support these businesses in a different way. And we did learn it from COVID and the stabilization. That money's going away soon. Let's not go back to the old way of doing business, which is think that we can put more money into the demand side of the equation and fix the supply. It doesn't work that way in childcare. So I think that that's, one of the things in terms of where we go, what's next is the workforce issues, but it just isn't a simple pay them more. We have to think about how we finance that. To the credit of Illinois, you have in your plan, your commission plan, recommendations on this. I think people were not asleep at the switch when we did this, and just, I think, get serious about how you get this money out there.
Well, I think really important to bring up this question of supply and demand as well, because it is instructive in terms of what other states have been experiencing. And I think one thing that I would compliment Illinois and the Smart Start plan that is being floated around right now is that it actually addresses both, right? I think one cautionary note for Illinois is that lots of states have, and this is a real temptation, when there's new dollars, there is a temptation to say, well, we can create X number of new slots for kids. And what we're finding around the country is just creating additional demand is not creating additional supply, right? And so Oregon is a great example of this. Just last year, they passed, I'll blank on the numbers, but millions of new dollars to expand their pre-K program by thousands of new children. And they have fallen far short of their goal. And the reason for that is there are no teachers. And so while they've got dollars in hand ready to pay these schools, they're having difficulty with the teachers. And so, one thing that I think is smart for Illinois to be thinking about is this question of how do you build the supply as a sort of a prerequisite to being able to build the demand. And I know, that compensation is a major part of that proposal. It's not, we talked about this earlier today at lunch. It's really not. It's almost something that has to be done together. But this question of how to increase supply is really critical, right? If you can't serve more kids without more teachers, but you also can't hire more teachers without kids, right? They have to go together, but creating that supply is really very, very critical. And I know we've got more speakers and more opportunities to jump into the conversation. So I'll pause there.
I am going to ask Emnet Ward and Martin Torres to join us while I take a minute. Emnet Ward is the HR director and interim CEO of Eyes on the Future Child Development Center. She's a member of We the Village Coalition. She participates on any number of important state collaboratives and conversations. She is deeply invested in early childhood. Eyes on the Future Child Development has been around for 30 years. I think it's going on your 30th year, correct? So it brings a provider's point of view to this conversation, but a provider who is constantly talking to others and really thinking about provider in the context of the system in which it works. And then Martin Torres really probably needs no introduction in this audience, but I, who met Martin first when he had no gray hair back in the day. There was a time, I also did not have gray hair at that time, just in all fairness, Martin, back in the days, even before I think you worked at the Latino Policy Forum, but you did some amazing work at Latino Policy Forum, worked in DC at another organization working to improve education before coming back here and then working in various positions as senior policy director, number 2 in the deputy governor's office, and then deputy governor for education, where he keeps his eye on an awful lot and I know brings an enormous amount of passion and expertise to the work that he does. So appreciate that you're joining us, because I know that there are a lot of high hopes and ambitions for the governor's office, and that you are at the center of all of that. I was going to say most of that, but no, all of that. We're just going to say all of that. So we're going to have a conversation as I channel my inner Oprah. And I'm going to start. We've heard Emnet and Martin from Dan and Linda. And Martin, I'm going to let you go first to, Smart Start has been referenced a few times. You guys have materials at your seats, both on some of the commission findings, but also some of the key features of Smart Start. But I'm going to give you a minute, but you've got to promise not to speechify too much. Okay? I fed you dinner, so now you got to be nice. Some of the key elements of Smart Start, why it makes sense now. Why are those the right things for Illinois to be doing? How do they build on the commission report or not? And then I'm going to give Emnet a chance to comment on sort of how that plays from a provider's point of view. Does that speak to the issues that she's been living with? And we'll go from there. So, but meanwhile, you guys have work to do too. Here you are, you're eating, you're drinking, you're thinking you've got nothing to do. No, no, no. You have paper and pens at your tables. Please write down questions as you have them, and then when you've got them, if you want to get them up here, wave them. And one of the crack members of the Advance Illinois team, see them standing up. They're such a good-looking group. So if someone tries to take it from you, don't be alarmed. They're there to take it from you. They'll make sure it gets up here, and we'll try to ask as many as we can. So please write those down so that you can join in. And Martin, Smart Start, what is it? Why is now the right time for it?
Sounds good. Thank you. So, Dan, I'll tell you, the governor is a man who believes in superlatives, and so he's going to give the rest of those governors a run for their money. I don't know that anyone has put him and Sarah Huckabee Sanders in the same sentence before, so we're gonna let that play out. I'll say a couple of things. Before entering public life, the governor would often pitch elected officials on the importance of early childhood education. State, federal, the governor is not new to this space. And depending on the audience, he might make the social justice and equity pitch, or he might make a more economic pitch and talk about return on investments. But regardless of his audience, the governor has been a champion for early childhood for a long time, has personally invested in that through his philanthropy, has been a national advocate on the subject. And so upon taking office, a big priority for him, I think if you asked him, he'd be the first person to tell you he would have wanted to do more in his first term. The world decided otherwise for everybody. But at the outset here, for his second term, he has made early childhood a huge priority. I would tell you, there's need across the board, and we'll talk a little bit about this later. But the governor wanted to go as far and as fast as possible in early childhood. Smart Start Illinois does that as a comprehensive plan. So 4 components to Smart Start Illinois: home visiting, early intervention, childcare, preschool expansion. Talk about each one of those things individually. So for home visiting, you're looking at a $5 million increase that will allow the state to serve 500 more families throughout the state. In early intervention, it is a $40 million increase, provide a 10% rate increase for providers, right? So we talk about it's not just enough to put the dollars, they need to pay people. So you work on that through the rate increase. You're also able to increase caseload for childcare. Again, how you pay workers. So the governor is going to roll out a brand new workforce compensation contracting model that builds off strengthen and grow. And the idea here is to provide base funding for providers that pays in advance as opposed to in arrear, and will be funded enough to, on average, pay childcare workers between $17 and $19 per hour. Now, this is a starting point. We're talking about year 1 for Smart Start Illinois, but it is a step in the right direction. And then for preschool expansion, the goal is to eliminate preschool deserts throughout the state. Robin talked a little bit about the geographic isolation, making sure we serve students. That is top of mind as we think about the allocation of new dollars, where those dollars are directed. And so we'll be making changes to the RFP, directing dollars in new ways. But it is a comprehensive plan. We're excited about it. That's $250 million just in year 1, additional funding in the out years. So it's a multi-year vision he has rolled out here. And in addition to the $250 in year 1, he's proposed an additional $100 million in capital funding, right? We had $100 million in capital funding several years ago in Rebuild Illinois. This adds another $100 million to that to allow entities to either build new space or renovate existing. So excited to talk about that, excited to hear from our panel on the subject.
Thank you. So those are, we're in, we're out. This does not happen to Dr. Phil, does it? No, or Oprah that I've ever noticed. So there are a lot of exciting elements that you have heard tonight, Emnet. You're familiar with the commission report. You've listened to some of the critical elements that Dan and Linda think we need to have in play. And you've heard some elements of Smart Start. And not to put too much pressure on you, but you're living this on a day-to-day basis. And what are the things that you're hearing that really speak to
the experience that you and other providers are having, what you're hearing. That's exactly what we need to do. And where are the things that you're not hearing that you wish you did?
First, it's almost surreal to think of the policies that you're talking about happening on the national level, because those policies, having been enacted in the state of Illinois, had a direct impact on my program as well as programs like mine. Just to give you guys some background, we serve a community on the north side of the city of Chicago, very close to Evanston. We serve over 200 children in our community, with 17 classrooms that are specifically dedicated to birth to 5-year-olds. That doesn't include our school-age programs, which we had to beef up a lot during all of the school shutdowns, because families needed resources to help their children navigate school online. And who do they come to? They come to the providers who are taking care of their children who are, 0 to 5 years old. So with that being said, we have over 60 staff members. 70% of them are dedicated to being in the classroom, but another 30% are dedicated just to being family resources to parents who don't know how to navigate a school system, let alone a community system. And so they are the social workers who help connect them to resources in the community, all of which would not have been possible had resources that came down during COVID were available. So we were able to not only guarantee or stabilize people's paychecks biweekly and ensure for them job security, but we were also able to provide services for children, diapers, wipes, food. When we were shut down for 2 months, parents were able to use us as a resource to help to stabilize their families, at the initial outset of COVID. That being said, we are actually still benefiting from the state's decision to provide funding to give money to the workforce in order to give raises, give bonuses. I'm just curious, how many of you guys are still working from home in some capacity, or people who are still working from home? So let me just let you know that as of June 2020, all of me and my staff came back to work. And we have been working 5 days a week, for a 10-hour operation for the last going on 3 years. Many of our staff at this point are feeling exhausted. But one thing that COVID made everybody realize is that how critical the workforce is in early childhood education, but the pay has not matched the appreciation for the efforts that we made to keep our communities going. So I would like to just say, with Smart Start, some of the things that I think are excellent about Smart Start is we've seen a 20% increase in children experiencing developmental delays because of COVID, and those families needing the resources, but not only that, them being comfortable with the idea that it's okay to get help for your child. That this actually is what is going to give them a strong start when they're ready to start school. And we do a lot of that prep work in the first 3 years that they are in our program. And not only that, I have seen several staff who we've groomed over the years to get their bachelor's, their master's degree in early childhood education, only to leave us for a few more dollars working a very basic entry-level job. And I'm hoping that the dollars that you will, hopefully that you will vote on for Smart Start will actually help us to turn that around, to offer competitive pay, because it's truly a skilled profession, and it takes a lot of years to develop staff to rise to that level of skill.
So my question, so one of the things, we're turning it back on, one of the things that came out of the commission report is that really, if we want to fully fund the system, and to do this right, to pay people what we need to pay them, to have enough of the personnel to really run robust programs, birth to 5 for all children who are eligible and should be served, would take another $9 billion. So while this is the work that we've done so far and the work that's on the table is important, my question back to you, Linda and Dan, whichever one of you wants to take this first, is how ambitious do you have to be? Can you start small and expand? For example, do you start with half-day kindergarten and move to full-day kindergarten? Do you just work on some regions and then move to others? How do you grow? You can't get $9 billion overnight. We all know that. What is the right way to think about it? So as you think about it, and as Illinois wrestles with being willing to take some big steps, what's the right way to think about how you grow and how you expand and how you deepen?
Yeah, great question. I think, my answer to that, Rama, would be if you can't do everything all at once, which is typically the case when it comes to sort of states, that you focus on doing it right, whatever it is you're doing. And so, you asked specifically this question of like, do you focus on half day instead of full day? I think, our experience around the country is that half day, pre-K, kindergarten, tends to target the wrong kids, right? That a 2.5 hour school day really is not something that most working families can accommodate. To be perfectly honest, a full school day isn't something that most working families can accommodate, even at 6.5 hours, right? That they need before school care or after school care. So, Linda, you weigh in here as well, but I would say, more important to do a few things really right than to do a larger number of things kind of halfway.
Mm-hmm. The one thing I would add to that, I think we talked about this a little bit earlier, is that one of the things that I think that we have to recognize that fixing what we already have is different from expanding and getting more. And I think you're on the right track here in Illinois with the facilities fund, and what you just said was the governor's plan in terms of increasing that. But I would agree 100% with this fixing what we have and doing it well. You heard me say this, when we did, again, I go back to my military experience a lot, but what our goal was in the military program when we set out to fix it, it wasn't to create a system or do any of this kind of stuff that we ended up with. It really was to make sure that when we were paying with DoD dollars, that wherever we were paying was a quality program for the child. And if you can start looking at what are you providing to children and what kind of quality, go after that and then figure out from there, where do you go? Because I think we could all spend the next dozen years just worried about $9 billion.
And I'm going to use that to, and then I'm going to hand this back to you, Martin. I think politically that's a challenge, right? The focusing on quality, because when you're going to spend a bunch more money, I mean, if we are able to put $250 million new dollars into programs, $100 million into facilities, and all that comes with that, and continue to do that over time, people want to see things from that. They want to see more slots. They want to see growth. Even when sometimes the work is stuff that's less visible. We need to strengthen the pipeline. We need to strengthen the compensation. We need to make sure that the infrastructure can handle that in a quality way. That's not always politically easy. So Martin, my question to you is, do you agree with that advice? And how do you manage the politics of that to make sure that people don't think of it just as the numbers, they understand some of that quality work? How do you message that, and how do you make that happen?
Thank you. So, can you hear me? Okay. I'll say a couple of things. First, I want to say the governor's budget proposal is a start to the conversation. And so we have champions like Senator Pacioni-Zayas and Representative Joyce Mason, and they've been fantastic. But there are 117 Democrats in the General Assembly, and there's a wide array of things that people care about, right? I mean, there are real arguments to be made for additional investments in healthcare. There's real arguments to be made for public safety, for affordable housing, for economic development. And so, we're making a case for $250 million in 1 year. It is what is possible within the confines of the resources available. But we need everybody in this room to also say, this is the proper and right investment for the state to make, and our friends in the General Assembly to authorize that. The second thing I would say here is, change takes time, right? I mean, Robin, I think this is part of the point you're making here. We are not looking to take $250 million and add it on to a system that as it exists today and move forward. I mean, we're talking about fundamental changes in every single programmatic area, right? In childcare, we're changing the contract structure. For preschool expansion, we're changing the RFP process, right? We need communities to be ready to build these slots. And it's not going to just be in school districts, right? I mean, I don't want us to think in that way. There are going to be community-based organizations that are critical to the rollout of all of this across the state. And so the kind of regional and community systems that we are building are going to be essential to helping communities plan for this work, right? And then the final thing I'll say is the state of Illinois cannot do this alone. We fundamentally can't overcome a $9 billion gap by ourselves, right? We're talking $250 million this year. I mean, we'd be doing this for generations and not reach $9 billion. If that was the approach we were going to take. I think we were all beyond excited at the prospect of Build Back Better. And we fundamentally need the federal government to step back up. I don't know when that's going to happen, but if this country is going to take early care and education seriously, that can't be done state by state by state. You can't depend on individual governors to climb Mount Everest by themselves. And so whether it's this president, the next president, we're going to need someone to make this a priority for Congress.
Linda, do you think there's a chance? What do you think the odds are that there is another bite at the Big Buildback Bet or something like that kind of package?
We expect that Senator Murray is going to reintroduce it. The Build Back Better was spun off of Child Care for Working Families Act that she introduced and had very broad Democratic support. She's going to reintroduce. We know that. Probably, go on record, I can say it, is no chance. That no chance in this next
I hope you're all
Congress.
eating your dessert because that was a hard one to swallow. But Linda, we appreciate the honesty.
You want honesty?
Yes, and she didn't even spend any time at the bar. So
But can I? I haven't had a drink yet. But the one thing
we're all going to start though.
See, I brought water with me.
Yeah, I saw that, but yes.
So there's no chance. That's where we left you off. Don't leave us on the cliff.
I want to say something adding on to that, though, because one good thing, and I didn't say it earlier, and Dan, you and I usually talk about this, is that there is very broad bipartisan support for child care in our Congress, both sides, the House and the Senate. But what we really have got to do is force these people to the table. Now, it's not going to be Build Back Better. That is a Democratic, bill. But last Congress, and I said this earlier, I was ecstatic to see the Burr-Scott bill come in, which took quite a few ideas out of the Build Back Better legislation and right into a Republican bill. And then Owens in the House introduced similar legislation. Now, it wasn't everything we want, but what was good about it was we finally had set parameters for negotiation in Congress. Okay, so what we now need to do is to make sure that we continue to try and shore up the Republican side of this issue and get them to the table. So in that there is hope. There really is. I think that there is going to be something happening, but do I think it's in this Congress? I don't. I just think
I will say I was struck. I'm still hearing it reverberating in my head, Dan, when you talked about 98% approval for more investment in early childhood. We can't get 98% of approval in this room about whether it's actually spring today, right? I mean, that's phenomenal, those kinds of numbers. And that is really consistent. I know you're seeing that. So I'm gonna ask you a question. I've got a couple questions here. And it ties in more generally. Compensation, one of the issues when we talk about compensation, we're often talking about the wage. And one of the things that one of our questioners is asking is, this also has to do with benefits. People aren't just leaving because they can make a few extra dollars somewhere. They're leaving if they can get benefits packages. And what would it take, and what are some of the ways that Illinois could get there? Are you seeing any other states that have really been able to bring benefits into the equation? And what would that involve, and any either shining examples or advice that you might have? And Dan, why don't you kick that off?
Sure. Well, I think the shining example that I would point to there is the District of Columbia at this point. I don't know if you're aware, but the council with local dollars. So it's interesting. Over the past 18 months, you'll see news articles every day about states launching new initiatives. almost to a one, they are with one-time federal COVID dollars. And so interesting to see that the council in DC about a year ago passed an initiative that is going to provide a $14,000 annual raise to every child care provider in the community, but has also coupled that with healthcare benefits for the first time. So I think DC is definitely the model that I would point to there.
Can I add this to this, Robin? Because I
No,
think one
I'm
of the
so
things
sorry.
you can do.
Oprah would never have done that. I'm so sorry.
so
Keep
sorry.
going.
Shame on me.
Please, add away.
No, but I do think that you're setting it up here in Illinois to really make it work, to get health care and benefits into it. When you're writing grants and contracts with providers, simply write it into the contract that they have to have those things. And that, I think that's not a hard fix.
No, you said something very important earlier. You said when you were doing this on the military side, it's what is it that we can provide, and then what can we expect in return?
Exactly.
And how do we? And then and both sides of that is what children need and what families need, and frankly, what the providers want to provide and what we, as the state want to deliver. So I think that thought. Right. So thank you for the question, for putting that in. Yeah. And how are you seeing that play out?
I think, I'm very proud to say that we're able to provide benefits, retirement plans for our staff, but I also understand that that's very unique and not all programs can do that. One of the things I noticed, especially with the latest Strengthen and Grow grant that came through the state, is dictating a certain percentage of the funding being used towards certain benefits. So for example, let's say if a program was going to be given for the next 3 months, $100,000, 50% of that had to be used towards some new type of either salary, compensation, or fringe benefit plan for your staff. If I, as a provider, know that this is reliable funding that I can count on for a quarter or for an entire year, I can start making shifts in my program to designate those dollars to the staff. But part of I'm very grateful for a lot of the resources that came through during COVID. However, when I think about receiving this money for the next 3 months, and that potentially these funds will sunset very soon, I had to think, do I create a benefit that I'm not able to sustain for an entire year if I'm getting funding for these 3 months, or do I do something else? Like provide maybe a one-time bonus, or pay the rent. Those are the key things I think providers need to be able to see in order to create these type of extra benefits. I need to know this money is coming in guaranteed for the next year for me to make this program change. If I'm not going to see it, then my program is going to starve, and so are my staff.
I so appreciate that, because I think this issue of sustainability is powerful. I think it's important for everybody in this audience to reflect on. And Martin, I'm going to hand this to you. How does that factor in? Are we, I appreciate the governor's plan is a multi-year plan, so that is one way to start down this path. But how do we build something that we know is going to sustain? And I am going to, one of the other questions from the audience is, what does it then look like 10 years from now? And I am going to have a follow-up question.
I want to think for a second with my advocate hat. So before I joined government and I thought about the work of coming to Springfield every year to talk with elected officials about the world in which we wanted to build. And when you do that, you take the long view, right? And when you're, my observation from my time in the executive branch is that the clock starts ticking as soon as he's sworn in. And you have 4 years to move the needle as far as you can. I would tell you, in the fiscal planning for this particular year, right, FY24, as we think about it, it starts and stops with what do we forecast for revenue, right? The governor's balanced 4 consecutive budgets. He intends to make it a 5th here in Illinois. And so what do we have to work with, right? And that's where we start this conversation. I would tell you, education does very well in this budget, from early childhood, K-12, higher ed. But the overall GRF spend in the governor's proposal is a decrease of 3%, right? So while education does well, the overall GRF portion of his proposal is slightly lower, and that's intentional to take a conservative approach at what we can spend and do. And I'll tell you, when we look at the out years, because it is a multi-year plan, we are taking a look at what do we expect revenue to be like in 25, 26, and 27, right? What do we expect to happen with recession? How do we expect that to affect future revenue? And so as we think about growth, we never want to position the state to make promises that it can't keep or to move an appropriation at a certain level and then have to claw that back. We heard from her talking about what it means for planning. I mean, part of the work with the DHS workforce compensation contracts is to build stability through base funding, right, in there. So we are serious when it comes to planning and forecasting and making sure that we plan in the out years, things that we can actually accomplish. And so when you hear the agencies or our office talk about what 25, 26, and 27 look like, we've spent a significant amount of time thinking, can we do this? And we understand folks want to go further. We want to do more. On one hand, that's great. We should go as far as we can. On the other, it is also a system that how quickly can it build up, right? I mean, does it make sense to say we're going to build 10,000 new slots instead of 5,000? I mean, can we achieve that, right? I mean, to your point, Dan. So,
yeah, I wanted to just add to something, Linda, you said earlier about looking at what systems do we have in place already and how are we mobilizing what we already have on the ground. Childcare and early education, at its heart, is a financial institution, and you can't produce quality work if you don't have the funding to do it. So one of the things that we should think about is it also requires a paradigm shift for providers. So, for example, let's say if I'm being reimbursed for children in a classroom, and all of the research says that to really provide quality care and education, I have to reduce my classroom size. One of the things you're going to get from a provider automatically is you're going to cut my revenue by 30%, 40%, 50%, because I used to be able to have 12 children in this classroom. Now you're telling me I only can have 8. Well, guess what? The state can shift its reimbursement amount for those children to make up for that deficit. So not only then are you already, you're mobilizing providers on the ground, but you're also moving them to see what quality care really looks like. And you're not going to be able to do that by just opening up new slots in a new area. What you're doing is actually the people who are committed to doing the work, the people who haven't left the industry because of burnout, who are here, you're incentivizing them to do better quality work. And that takes, I think, less extra dollars than starting from scratch in a totally different place.
But it's going to run into those same political issues. So we are getting close to the end of our time. I'm going to give you each one last thing to leave our audience with. And then we're going to have some closing remarks from Senator Pacione-Zayas, who gives this a great deal of thought on a daily basis. So, but Linda and Dan, I'm going to start with the two of you. What is the advice you would leave? So you have a large group of people here, including legislators, who are going to be working on this issue this year and for years to come. What is the advice that you would leave them with? What are the things that they absolutely have to remember and keep in mind as we are going down this path? What are the pieces maybe that you want to be sure don't get lost from Smart Start, from the commission report, and what are the ones you really want to, that you worry about or need to emphasize?
You want to go first?
Linda first.
No?
Like I said, Dr. Dan first.
Yeah.
All right. So I would say two things quickly. I think, again, to this question of supply and demand, we frequently use the quote from the baseball movie Field of Dreams, right? If you build it, they will come. But remember that it is, if you build it, they will come. It's not, if more of them come, you will be able to build it, because states have found that is not necessarily the case. The other thing that and this, Robin, may or may not even be what you were thinking of, but I want to just remind you quickly that childcare doesn't exist. And I don't mean it physically doesn't exist. I mean conceptually. It really doesn't exist. For a long time, we have thought about childcare as being this warm, custodial place where children can be kept safe while their parents go to work, right? And that's what childcare is, and that learning begins when children enter kindergarten. And that's not true. And so when you think about what childcare actually is, right? It is not only a learning environment, it is arguably the learning environment for children. It is the most consequential period in all of human development. And what happens during those years is of huge importance. And so that we have a system right now where we have a revolving door of poorly qualified and poorly compensated teachers in those classrooms, and I want to call them in every instance teachers because that's what they are, is a disservice to children, and it's ultimately a disservice to the taxpayers of Illinois. You are going to end up paying for the consequences of the poor, and this is not an Illinois problem, by the way. This is a national conversation. But I want to just leave you with that food for thought to think about what we're actually talking about. We're talking about learning environments, and we're talking about building brains. And when you begin from that point of view, you begin to look at this question very, very differently. Okay.
Linda?
There's so many things that thoughts going through my mind in terms of what I would say. I think that, first of all, I think the governor should hire Emnet. Okay, because she understands this, and I really mean that. I mean, there's somebody who really understands exactly what's going on in this program. and I'm sure. But no, I think what we have in this country right now, as I said, we have a broken business model, but we have a broken, if you want to call it a system, we have a broken system as well, because the system itself isn't serving most parents well. It's very inflexible when you think about it, and there's no reason for them to be anything but what they are. But parents don't need 9 to 5 childcare for the most part anymore. They need childcare at different odd hours, odd shifts, a whole bunch of reasons why we need a more flexible system in this country. But we don't incentivize that system either. And so the reason that the system is literally a 9 to 5 is because they can't afford to do anything but what they're doing now. And so as we think about this, I keep going back to the idea that we really have to think about how, not just how much money, but how we get money into the system and incentivize the things that, guess what, parents need and want. And I go across the country and I hear all the time from different sectors. Very seldom are we hearing from parents, and I want to encourage all of you to go out there and figure out what's going on with your parents and their lives, the real lives of our families who are really in chaos because of this lack of childcare that they can literally afford and feel safe with. We do a lot of survey work. The number one thing parents want is somebody they can trust. And they don't feel like they're getting it in our country. Isn't that sad? That is very sad. So I would not forget the parents in the equation. I think we need to get more businesses to the table in this country because businesses clearly have a stake in this game and benefit from it, and they're often left out of the conversation. So I think that the last thing I would say is that I would caution or remind people. I used to live in Belleville, so I know what it's like to live in the rural part of the state of Illinois. It's Chicago and everything else. I want to caution all of you.
That's not the way it is under this governor.
Okay, I'm not saying that.
I will tell you that right now. That is not the way.
But I do want people to think differently about rural childcare than they think about the cities, the big cities. I think we have not paid enough attention to rural parts of our country and our states. And I think we're losing a lot of people by not paying attention. So think how you apply what you're doing in rural parts of our country.
All right, Emnet and Martin, I'm gonna hold you on a tighter time so that we can wrap. But Emnet, last thought from you on things that are absolutely essential if we are to make serious transformational change going forward.
I think we need to change how programs are funded in the sense that most of them are on a reimbursement basis, on an income guideline basis. So what happens to the families that now fall outside of that guideline? They are at a loss, and the providers are also at a loss. So I think we have to really look at the funding mechanism. I think the second thing is, with all the research out there about child development and the first 5 years of life being so crucial, I myself am a mother of 3 children, 6 and under, and have really seen the value of an early education program. But if that is not compelling enough, think about human capitalization. This is all about people economics. Malcolm Gladwell did a talk at Microsoft about this very specific thing. Just about how when systems are not set up properly, you lose out on a wealth of capitalizing on human potential. In the state of Illinois, if we truly believe that early childhood education and care is the place that we can make a difference in the future, then we have to start putting policy and funding behind that mechanism. If we do not, then it's a lot of smoke.
And the last, and it's not the question you're expecting, Martin, right now, but there's no getting around the fact, does he look nervous? I love that. I love that. Now I'm feeling my Oprah. There's no question this is an ambitious plan. It needs to be sustained. You're hearing that from everybody along the table. There's so much that you've got to do simultaneously, right? You've got to be working on the workforce. You've got to be dealing with facilities. You've got to be dealing with governance, bringing things together. It all doesn't work if you don't do that. People have to know it's going to continue to grow. We've got a $9 billion, but we've got other needs too. One of the questions here, and I'm sorry I didn't get to all of them, was also about post-secondary. There's a version of this that's going on in post-secondary as well, where people want to send their children on to school, but the money isn't there for that either. So how do we prioritize and go deep and ambitious here without sacrificing the other things that are so critically important? And how are you going to manage it? He's eager to answer this. Isn't that great?
I love this question, Robin. First of all, what I appreciate about this question is that it recognizes the tremendous need for additional dollars, right? Everything in education is cost intensive. We need billions of more dollars for early childhood. We need billions of more dollars for K-12. Before I came up here, Representative Ammons, I'm not sure if Representative Ammons is still here, but she came up to me and wanted to chit-chat about the early childhood, or the Higher Education Funding Commission, and the work that will take place there. And the conversation there is around, how do we provide a better intentional strategic framework for state appropriations for public universities? Right now, we simply take last year's appropriation and we mark it up by a percentage, and then we give more money out. It does not make sense. It is not strategic. We are better than that in the state of Illinois, and we will improve that. Yes, I mean, it's work that's underway. But the governor cares deeply about early childhood, but cares deeply about all facets of education, and ultimately understands education is about helping every individual on their own, economic journey, but it's also about revitalizing communities and economic development. And how do we manage to make Illinois an attractive and appealing place to live, right? How do we entice businesses that are already here to expand their footprint? How do we entice businesses who aren't here to come to Illinois? It's human capital, right? So when we looked at our education budget, the governor proposed significant increases throughout the continuum. We talked about early childhood already. He proposed another $350 million for evidence-based funding, a new 3-year, $70 million a year teacher pipeline pilot program. Again, talking about educators here. But in Illinois, 20% of districts have over 80% of the unfilled teaching positions, right? It is, we know where these vacancies are, and we're going to direct resources to them and help them come up with their locally solutioned policies to do better. And in higher ed, the North Star is college affordability, right? How do we provide value to the taxpayers and families of Illinois? We have about 150,000 students graduating high school every year. How do we keep them here? Or how do we provide value? 2 ways we're looking to do that. First is through our need-based financial aid program. Governor proposed another $100 million for the MAP program. That will allow virtually every community college student at or below the median income to go to community college for free. It'll provide more than 40% of students at public universities who are at or below the median income the ability to go tuition-free through a combination of Pell and MAP. That's not enough. The governor proposed a 7% increase for university and community college operations. That is the single largest one-year increase in over 20 years. Now, but the work's just getting started. We have a tremendous more amount to do. I would tell you, I know there are some university presidents here. I have talked to them and their trustees about how we hold the line on tuition, right? Because our students and their families see the sticker price of an institution. We're a high sticker price, high financial aid model state. And our competitors may have an alternative model. And they may never go to an Illinois State or a Northern or a Southern or GSU or otherwise and understand what the actual net price is to them because they're scared off of the sticker price. We need to hold that down. We need to suppress that. The state plays a leadership role in that. We have a tremendous amount to do, Robin.
Well, we don't have a chance to do the follow-up, which is how are we going to sustain that over time? But we love hearing those numbers and to talk about equitable distribution on post-secondary. Maybe that will be the topic for next year. So there's a lot of work to be done. Please join me. We've got one more piece, but please join me in thanking Dan and Linda and Martin and Emnet. And I'm going to invite up. First of all, I want to welcome. There's a number of other. They just don't want to stop clapping. You guys are great. Stay here for just another minute so there's not chaos on the podium. But there are a whole bunch of other legislators. I know the committees ran late that joined us. Representative Mussman is great to see you. Representative Hirschauer, Representative Favor-Diaz, Senator Pacione-Zaya is obviously here. Representative Ammons, Representative Weaver. And I think I already said hello to Senator Adliam. So, but Senator Pacione-Zaya, who also needs no introduction, who has been a champion for children generally, early childhood in particular, is deeply knowledgeable. And you know, another part of her life is at the Erickson Institute, which does more good by accident than most people do intentionally. So, but to offer some closing thoughts and bring all this together as only you can, Senator Pacione-Zaya.
Yay! How are you guys? I'm standing between you all and another cocktail. So let me try to wrap this really nicely. First of all, let's give it up to Robin and the staff of Advance Illinois. Our illustrious panel here. I want to also acknowledge all the legislators because we've had a full day. We are definitely at max capacity with information. I just kind of want to highlight a few areas that I think were really, again, not new information, but always good to kind of like double down on, right? We talked about the workforce. And really, this is, I know it's about the whole equity piece and I know it's about the labor piece, but we're really doing relationship investment. Like the workforce are brain builders, but they are like relationship experts because we know that young children can only learn in the context of relationships. And, the individuals, the professionals, the educators that are caring for our youngest are truly, have a certain level of expertise that we have to continue to invest in terms of the pipeline, in terms of retention, in terms of compensation and benefits. And this is not just a racial equity issue. This is a gender equity issue. This is an economic issue. This is a geographic equity. It touches everything. The second piece I want to touch on, because Illinois, I think, does a really great job at this, but we can even be doing better, is, our mixed delivery system. I can agree with Linda that we don't have a system. It's kind of tragic at some points. But it can be kind of this elaborate ecosystem, right? But we definitely need to level up in terms of the investments that we make in our community-based organizations because they provide the multi-generational and the comprehensive and the culturally congruent resources and services. And, we have home-based providers that are often considered like an afterthought, but they are so critical because the majority of our youngest go to these family childcare providers. And then, of course, our school districts that are able to really do this well and have great articulation between preschool and kindergarten and have the after and before care. All of that is a package, right? But also we need to think about too, like, how are we doing this in a very intentional way with partnering with Head Start and Early Head Start? We don't want to leave money on the table, right? And we shouldn't be, going after families and children that could be a better match for Head Start and Early Head Start so that we can truly do this expansion in a very intentional and deliberate way. And then how do we, really bring families, children, and providers into the center? I think the point was made, the folks closest to the problems need to be a part of the solutions, need to be informing those solutions. I've always had a challenge being in this space where oftentimes the folks who are making the decisions never have put their kids through childcare or through center-based care or even school, preschool, the preschool in our school settings. So it's really important that we bring folks to the center in that kind of discussion. And so we're really at this spot where, this is a generational opportunity. We have a governor where we don't have to start at ground zero. That's why we have a running start to Smart Start, right? We have an opportunity to change life and generational trajectories. And, I like to kind of reference what they call the Overton window. This is something, since I've been in this role, learned about. It's one of these, political wonky words or whatever. It's the range of policies politically acceptable to the masses at a given time, right? So it's this window that goes from when an idea is considered unthinkable or radical to acceptable to sensible to popular to policy and then back. We're at that Overton window. That's that moment right now for us. And, we have generations looking ahead that are going to benefit from this, and we all get to be a part of it, right? So, I wouldn't be an organizer if I didn't do a call to action, right? So, for me, I think what's really important walking away from this, we need to flood the public discourse. I need our writers to get out there, do our letters to the editor, our op-eds. You need to be inserting what we call at Erickson, finding the baby in every single conversation that you have. Because COVID provided us a window of opportunity to really double down on this investment. A lot of us in this space, in this room, understand what childcare means, but now everybody who has seen what happened during the pandemic to our system can't unsee it. And therefore, we have to constantly remind that, right? We need to also engage our colleagues here. We're trying to do that work in a very deliberate way, and I couldn't have a better partner in the process as Rep. Mason, because let's give that. Her daughter is a SPED teacher, and her daughter is right there at the front lines, and she sees this through her eyes, right? And we have to, continue to, like I said, recenter the people who are often relegated to the margins, the folks who have to live with our decisions or the folks who have to implement our decisions. They need to be at the center right there, co-designing with us so that we can really truly have this comprehensive, coordinated, aligned, anti-racist, equitable system, right? And so I invite you all to join us tomorrow. We have a subject matter hearing in our joint Senate and Housing Committee. We're going to be looking at the prenatal to age 3 spectrum. We've got, our government folks, and we've got our providers and our parent voices, and, some of these folks are in the room preparing, ready to rock it out. So I really want to I've got some logistical stuff they left me with to share with y'all. I'd be remiss if I didn't shout out the legislative co-chairs for this particular event. This is not just lending your name. This is really, we're ambassadors. They're obligating us to continue to be in this work, but it's not an obligation for folks. I know that, Rep. Ammons was mentioned, and we've got Rep. Hammond, and we've got Rep. Mason, and we've got Senator Turner, and we've got Rep. Davis, who've all lent their names. There's 40 plus partner organizations who co-sponsored this particular event. And this is, again, not just a name thing. This is the people who are doing the work day in and day out. And, the last piece, you will get some follow-up resources in a couple of weeks, to continue your engagement, or we call homework, right? Advanced Illinois loves to give the homework. And we're here until 9. The bar's open until 8:45, so let's get it. Have a great night.